It was the most brutal crackdown in Iran in decades. In January, security forces opened fire on anti-government protesters, including with live ammunition. The real death toll remains unclear, but healthcare workers describe how thousands of dead and wounded men, women, and children quickly overwhelmed medical facilities around the country.
The turnover was so incredibly insane that every 15 to 30 minutes, the entire emergency ward would be emptied and then refilled with new patients.
This doctor asked for his name to be withheld and his voice altered for his own security. He's one of 9 Iranian medical professionals the AP spoke with inside and outside the country. Working with Berlin-based Mnemonic, which has been documenting human rights violations in Iran, the AP independently verified a dozen videos that show what rights groups are calling a systematic assault on healthcare facilities, patients, and doctors, and attempts to block medical care.
You had plainclothes agents bursting into the hospital, into the emergency ward with AK-47s on their shoulders, threatening the staff and the admitted patients.
Details of the crackdown and aftermath have been slow to emerge because of internet restrictions imposed by authorities. The ongoing campaign of arrest and intimidation has kept many from speaking publicly. According to activists, dozens of medical professionals have also been detained. One video film from inside a hospital shows security forces breaking a glass door to get inside. Doctors say wounded protesters have been hunted down in hospitals and detained. A health ministry spokesman denied reports of treatment being prevented or protesters being taken from the hospitals.
We knew that no matter what we did for the patients, they wouldn't be safe once they stepped right outside the hospital.
In order to protect the patients, he says medical staff would try and omit mention of gunshots in official records.
There was a lot of cases with a gunshot to the abdomen, which we simply identified as abdominal pain. There was one patient that had gunshots to the genital parts, which we simply identified as urology.
As Iranian authorities warn medical staff to be ready in the event of a US military strike, this doctor says he can't forget the trauma he's already witnessed.
I still have trouble sleeping at nights. Sometimes I don't sleep at all.